All righty. Well, welcome everyone to Mary Center's virtual town hall. I am Heather Morgan, Executive Vice President of Development at Mary Center, and I'm delighted to have you join us for this very special gathering. We're extremely grateful to have you for making time today out of your day to be with us. Before we start our official program, I have just a few housekeeping items to share. First of all, today's town hall will include a 15-minute question and answer session. Thanks to those of you who have submitted questions in advance, but if you didn't get a chance to submit questions during the registration process, not to worry, there's still an opportunity to share questions via the Q&A feature, which you can find at the bottom of your Zoom menu bar. Your questions will be routed to my colleague, Sarah, and she'll manage the question flow. During the Q&A portion of the program, we'll read aloud for everyone to hear. Secondly, out of respect for everyone's time, we plan to end promptly at 10:15 this morning. We'll try to respond to as many questions as possible within the time that we have available. And if there are questions that we don't get to, we'll be in touch with you directly. We definitely want to make sure there aren't any questions that go unanswered. Lastly, please note today's session is being recorded and we'll make the recording available to everyone next week. Now, let's get on with it. Dr. Elliott, I'll turn it over to you.
Thank you, Heather, and thank you everybody else for joining because it does mean a lot to us. Number one, this is a supporter town hall, and it is important for us to keep you all engaged and in the know as to what we're doing and how we're growing and where we're going, most importantly. But I definitely want to thank Heather and her team for establishing this, and my colleagues, Dr. Jester, who's the EVP of Dental Services, and Christian Campanwello, who is the EVP of Marketing Communication. This means a lot. Communication is everything, because without it, how are you going to know what we're doing and making sure that we're putting good faith in the efforts that you entrust us with? And so one of the things I wanted to talk about in terms of the highlights of 2024 is that at the heart of Mary Center, we're a community health center, and our core services are med, dent, behavioral health. And I'm very, very happy to say that in all three service lines, we are definitely meeting the need of the community. In many situations, we can't meet the need because there's so much demand. And so we've had providers doing their due diligence and working their very hardest to make sure that we can keep up. But as you're going to hear later on this conversation, that the demand is high, and we're still looking at hiring additional providers and making sure we have spaces to put them because it's such a critical need. And especially in areas like Prince George's County, where the obstetric need is extremely high. That is the #1 area of need in Prince George's County in terms of primary care. And we've known for years that in one of our sites in particular, especially during the pandemic, up to 80% of the women that were not eligible for Medicaid were pregnant in that month. And sometimes at that site, up to 55% of the individuals at that site were ineligible for Medicaid. And so fortunately, with a lot of advocacy on our part and a lot of advocacy on your all's part, we were able to work with the state of Maryland. And as you all may know, the state of Maryland has passed the Healthy Babies Act, which is tremendous because what it does, this says that any individual who's pregnant, from the moment they identify through 16 weeks postpartum, they shall have coverage, and it's all through Medicaid. And so that means a lot to us because it means as we stayed in there in the good fight during the pandemic and never shut our door, that we still have the capacity to just keep doing what we're doing. Excuse me. So those kind of activities, in terms of where we are, how we're performing, what we're doing, really mean a lot in terms of what we do and our obligation to the participants, but also our obligation to you as supporters. And I think it's important that you all understand that. But from where we are today, I think it's really important to hand off to Christian to talk about our strategic plan. The strategic plan is, I don't want to steal your thunder, Christian, but the strategic plan is something that is definitely board guided. The entire senior team was involved. We had at least, I think, 6 or 8 board members that were involved in that. And so we're really, really proud of what we come up with. And with that, I'd like to hand that over to Christian.
Thank you so much. Welcome, everybody, and good morning. Beautiful day here in Washington, D.C. area. I'm excited to be a part of this. And, if I'm 90 days into my tenure here, and it's just been an incredible exposure to the differences that we're making out in the marketplace. As you all know, we've got a core set of mission, vision, and values that sort of guide these decisions as we move forward. And really everything that we do is built off of the idea of who we want to be, which is the vision, and what we want to do every single day as an organization, which is our mission. And then we're guided into those things by our values. And the strategic pillars sort of are the foundation of this strategic plan. And as we move forward, if you could just turn to the next slide. You see a little bit about our main priorities here. The four main priorities are team vitality, participant focus, and financial strength and service innovation. Each of these things have an objective that is sort of overarching for the organization, and each individual department then takes that objective and turns it into active tasks and responsibilities for them to move forward. If we go right to the next slide, I'll talk a little bit about the objectives and initiatives for each one of these. So we have sort of an implementation plan that includes sort of a team leader, completion metrics, and key deliverables, and a deadline for each of these goals. And we have part of our EVP team, including myself, are the leadership in this and making sure that this is occurring every single day. First one is really about that we want to build our organization and make sure that we have our organizational capacity is built for service. So we want to strengthen internal capabilities to support our expanded services. The initiatives of upgrading technology, infrastructure, enhancing staff training, improving operational efficiencies. The impact, we think, will ensure that we have a robust foundation that supports the scalability and sustainability of our services. Next, we want to talk a little bit about expanding our integrated health services. So we want to enhance the scope and reach of our health services to address emerging community and health needs, be responsive to things that are going on in our service areas. We want to introduce specialized care units for chronic diseases, increase our mobile health units, and reach really underserved areas. The impact there is, I think, that we'll be able to expand our services. We hopefully want to see more residents in our service areas coming to our locations, making sure that they are all receiving essential health services as we drive forward. Third is driving self-sustainability. Really, the objective here is that we want to ensure we're driving revenue without sacrificing accessibility of our services to our community. You can see that we have putting equitable systems in place to improve visibility, making sure that as leaders, we are very, very well aware of the financial sustainability of the organization. And as we move forward, making sure that we have money to invest back into our service areas. And last is, enhancing our social services. Broaden social services to support mental health and social well-being. We want to, looking at launching and expanding all of our services, including dental and social service aspects of things, so we can have a much bigger effect on the community as a whole. Overall, our importance of your support, your continued support is crucial in bringing this plan to fruition. Our investment in time and energy, and your investment in Mary Center means investing in healthier, more educated and thriving communities, which is ultimately the goal of the organization. So we're committed as a group and as an organization to our mission of embracing all communities with quality healthcare and education and social services. And together, we believe that we can build a future where everyone can thrive. So thank you for your unwavering support and belief in our mission. And I look forward to meeting some of you at our venues. So I'm going to drop this off to Dr. Gesker, who's going to talk a little bit more about in the dental area. So, Dr. Gesker.
Well, thank you, Christian. Well, good morning, everybody. My name is Dr. Rich Gesker, EVP of Dentistry. I've been with Mary Center for 14 years. Can you imagine that? And over 14 years, we have developed a thriving dental program. In fact, this year, we're having a record year in dentistry. We're going to have 58,000 encounters, and somehow year to date, we're ahead of schedule. So if you've never visited or witnessed our dental facilities, please, I welcome you to come visit us. And if you're looking for a great dentist, we have 20 of them. And by the way, we're open 6 days a week. And yes, we have Saturday hours, so we can accommodate everybody. But as I speak to dental, we have some of the most modern equipment out there in dentistry. We're at about as modern as can be, and we have a super kind and talented staff. And you'll feel the vibe, and you'll feel that feeling, that intangible, when you do visit our dental facilities and all our departments, medical and behavioral health as well. I want to share with you one story of ours that exemplifies our ability to expand. And we are expanding every single year. For the last 3 years, we've had, are you ready for this? 20% growth year over year for the last 3 years. And we are literally beyond capacity. We have a mobile unit that we use as an overflow unit temporarily, even though that's in great demand and great request throughout the community in all the counties, DC, Montgomery County, and Prince George's County. It's a wonderful, literally, vehicle to get people into dental care. We have partnerships with Howard University and Delta Dental. We have a senior oral health initiative that gets care to seniors in the DMV area, which we're very proud of. We have not only a focus on adults, older adults, but also pediatrics. However, our relationship with Howard University and the support that Delta Dental has provided us really allows us to impact not just those two populations, but our entire service line of patients. Keep in mind, dental does not stand by itself. Dental is fully integrated with medical and behavioral health. So it's a wonderful umbrella scope of holistic approach to care to get everybody into care. The next slide is actually a video I'd like to share with you. Oh, got a little ahead of myself here. I'd like to share with you a video of one of my favorite patients, Gail, who needed a substantial amount of dental work. And the out-of-pocket costs, as you know, are expensive in dentistry. But because of the foundation support, and support like yourself, we're able to get care to the people in our community, which I'm really proud of. Can someone please cue up the video and let's share the video with everybody?
I've been a patient at Mary Center for many years, and I was in need of serious dental care. It was the first time that I decided to go to the dental department. I had my own private dentist, and they would stop taking my insurance. So I remember that the Mary Center offered the dental program for seniors, and I am a senior. So when I went to the dental program at the Mary Center, I was so surprised of the quality of care that they gave. They explained to me they have a program for seniors, and at first they wanted to offer a sliding scale, a fee of sliding scale. I agreed to it. I was able to get a credit care. And then when the procedure was done, they told me I didn't have to pay. I mean, the Mary Center overall gives you the best healthcare service that's so necessary, and it's like the best kept secret. And they offer so many services, referrals, social service, nutrition program. And I just love the Mary Center. It's just the best place that you can come, and it shows you what healthcare looks like.
Well, I'm so proud of that video and so proud of Gail. And, when someone looks, it's hard for a person to change providers, especially a dentist. And that's only one of our 58,000 stories every single year. And I'm also very proud of the wonderful staff that takes care of them too. That's our hygienist, Faiza, who's been with us 12 years as well. So thank you, Faiza, as well. You'll see here in this facility here is we have because of the support of the Shatner Foundation, we are able to fully build out and fully equip 5 treatment rooms, one of which is a special needs facility and a special needs chair for those who have difficulty getting in and out of a physical chair and who might need a little more attention, a little more, attention to detail, a little more love during their visit. So we're very, very proud and thankful from the Shatner Foundation that's supporting this capital improvement initiative. These chairs right here, are you ready for this? They have a life of 15 years, right? So this is a long-term return on investment of 5 chairs that will be in the community for 15 more years to come. This allows us to expand and also allows to get more care, more scope of services. Our team of 20 dentists, somehow they're all gravitating to the new beautiful suite. So it's a really, really nice environment. I welcome you to come for a tour. Can I have a next slide, please? Your contributions make a meaningful impact. Dentistry is expensive. And it's not only expensive, it's expensive because it's so labor intensive and as well as technology intensive. You'll see on the left-hand side, this panographic machine. In the old days, we used to have digital film. We have digital film. It's helped cut our costs. For every dollar investment in Mary Center in our equipment helps us not only to cut costs, but allows us to be more financially self-sustainable. And I'm quite proud about that. So I believe my time might be coming up. I'm going to pass it back to our CEO, Dr. Elliott, and we would like to soon field
Thanks,
some
Rich.
questions.
Dr. Gester, my apologies. What I'd like to say is that the overview of the strategic plan and of the discussion of growth and where we're going into the future, and then the segue into Dr. Gester talking about all the wonderful things we're doing in dentistry. It's just an example of how we're trying to be true to our participants and consistent with our strategic plan. But there's two other areas that really want to highlight. And one of the things we were fortunate enough with a generous support through the Clark Foundation is we were able to bring on maternal fetal medicine specialists. An MFM, which is what we typically call them in the business world, is they are the ones that do an additional 3 years after 4 years of obstetrics and gynecology training, and they specifically focus on high-risk pregnancy. So for myself as a general OBGYN, take care of a lot of individuals in the past, but when something exceeds my scope, that's who I hand it off to. They're the big brains in the room that tell us about the clinical scenario to help us get through it and help us navigate that patient to the bottom, to the end of the line, finish line, so that they have a healthy outcome for both mother and baby. Because as you know, in the District of Columbia and the regional area, maternal fetal outcomes are not where they need to be. And so by us bringing that on, and bringing that type of service on really does make an impact for those individuals who otherwise can't find them, because especially in specialist care, it's extremely hard, even if you have private insurance. So irrespective of the type of insurance you have, it is very hard to find an MFM. So we're very fortunate and we're very thankful for all the support we have, and very, very thankful to the Clark Foundation in terms of moving that through. One of the other things that we're doing is we're expanding our capacity with pediatric psych services. Mental health and mental well-being is also one of those areas that has long been underappreciated for many years. And we were very fortunate to have had a long history with Georgetown University in terms of having fellows come through, and we're expanding on them. And so we recognize that children, especially coming out of the pandemic, they really did have a lot of hits to what was happening to their normal growth and development, especially the behavioral health space. And so by having pediatric psych services and having clinical fellows in there and expanding that capacity is very, very hard, because I can tell you that everywhere you go, there's just not enough. Whether or not they have school-based psychiatrists or school-based mental health therapists, they still need, again, specialists to refer them to. And so we're so very happy that we were able to expand on that. And so with that, I'd like to hand it off to Heather, so we can move into the question and answer.
All right, thank you so much. All right, we are going to move into the question and answer session, and we did receive a number of questions that were submitted in advance, so we're going to start with that. The first question is, it's a great question. How is the ending of COVID funding affecting Mary Center? Turn that to Dr. Elliott.
Thanks, Heather. It's affecting everybody. Fortunately for us, we were able to use COVID funding to do a lot of enhancements. We were able to put a ramp in our Silver Spring for individuals with disabilities. We've been able to upgrade the elevator at Silver Spring. We put in a pad so we could put the dental cruiser there for Dr. Gester's team, so that we can increase our access to care in case the actual office space gets filled up. And so we definitely did it to support a lot of the staffing metrics that we had, but we also had to make some critical decisions. And I think that we're in a space right now where we were wise and frugal in how we use the COVID funding. but it's definitely something that we're very grateful for, and we definitely appreciate all the efforts that both the local and federal jurisdictions took to support us.
Excellent. Thanks so much. All right. Question number 2. Do you assist people with disabilities due to cognitive ability or no family to apply for services, to apply for benefits such as SSI, Medicaid, SNAP benefits, etc.?
Yeah, that's a great question because it really gives us a chance to, really shout out and say how proud we are of our patient care navigators, of our family support workers. You think of a community health center, you might not realize that there's many, many other players and stakeholders in this. And so typically we don't have a person with a cognitive deficit who comes in on their own, but we're very fortunate because we have a lot of partnerships in the community where they bring them to us to help support them. And so it's our obligation as a federally qualified health center to make sure that we support any individual that comes through and try to make sure that we can get them signed up for any opportunities that they have to support their healthcare. And so, yes, we do. And that comes to the moment they hit the door, patient care navigator. I would even go so far as security. Our security team is equivalent to being just a member of the entire staff, and they know our space as well. They know how to direct people to the right locations. And so when security steps in and they meet them and they greet them at the door, somebody asks for help, they're going to help navigate them to the patient care navigator. The patient care navigator is going to work with the operational site manager, who will also work with the family support worker, and then it goes from there. It might even be a medical assistant, or it might be a nurse who's passing by, but the point is that everybody is vested in the interest of anyone who comes in.
Thank you, Dr. Elliott. All right, this is a dental related question. I've driven past your Silver Spring Clinic and seen the Mary Center Dental Cruiser parked there. When is that used and how many people can receive services in the dental cruiser at one time? This is for Dr. Gesker.
Oh, that's a great question. Well, if you're driving by and seeing it, there's no excuse for you to stop on in and say hello as well. I would love to have you a tour of the dental cruiser. Our dental cruiser, believe it or not, is 10 years old. It's a fully equipped, self-sustainable dental office, essentially a dental practice on wheels. We're so proud of our dental program, we decided to take it on the road, and it really provides a lot of great access. So however you provide encounters or visits per year, it's a 3-chair, fully mobile, independent dental practice. We could pull this up to any school or any health fair and start providing care at those locations. Right now, as Dr. Elliott mentioned, because of COVID funds, we were able to stabilize the dental unit on a parking pad with a shoreline, which basically you plug it in for electricity so the generator doesn't have to operate. And it operates as our overflow to our 344 office. Our 344 office, Silver Spring location. Our Silver Spring location has 8 dental chairs. So we just took an 8 dental chair practice and expanded 3 chairs immediately. In our future endeavors to expand services and expand to different locations, we'll be utilizing the dental bus to help build the patient base and get people familiar with Mary Center and welcome into our network as we build new and future sites. However, it's fully operational. It stays within a certain radius of a fixed dental, one of our 3 locations, a fixed dental facility, because it's extremely important to us that patients have continuity of care. If we see them on a bus, we want to make darn sure that they are seen in our fixed facility when the bus is not present. But please come tour our dental bus. It's extremely impressive. And by the way, it's my favorite dental practice that I have ever built.
Excellent. Thanks, Dr. Gesker. All right. This is another question from one of our attendees. I've been hearing a lot about the increase in the number of teens using fentanyl and other drugs such as cocaine. Is Mary Center providing any resources or support for teens in our community dealing with substance abuse?
That is a absolutely fantastic question that ties into expanding on pediatric adolescent psychiatry services. Substance use disorder, substance dependency is actually something that's just far too high. I will say that typically we think about teens, but for example, individuals 25 and below. Well, let me back up a little bit. We work with our education, prevention strategies. We go to schools, we present things. We talk about Narcan distribution and training. And when teens do come in, we offer snacks and water and so forth, typical refreshments for them to be there, so they know that they're not going to feel like they're sitting in class. And we do receive referrals from crisis centers, school treatment program in Maryland and individuals respectively. But one of the facts that I wanted to bring up is that, you know, the genie is out of the bottle when it comes to THC or marijuana use. And there's different ways teens have been using it. And it's to the point now where it is so easy for teens to get access to this that they're children. And so they don't realize what they're getting into. And unfortunately, sometimes when they obtain this stuff through what they consider friends or a trusted person, um, sometimes this stuff is laced with fentanyl. And sometimes that could be the last time a child might actually see their parent that day. So this is a very, very, very challenging matter. And with respect to THC, the incidence of acute psychotic disorder has gone up significantly so. And young adults 25 and below, their brains are still developing. And so it's absolutely important that we get to them when they're young, that we do everything we can to help them understand the appropriate strategies to navigate if you're stressed out, if you're feeling alone, if you're feeling conflict between friends, if something's happening at home. It's really, really important for us to make sure that we get them at all different spaces, but also let the community know that if they don't have the answer, we might not have the answer, but we certainly are going to do our darndest to find support for those kids. That's a great question.
Great, thank you so much. All right, another question related to dental. I believe someone has, one of our participants on the call today has been reading our materials and read about a special needs chair, dental chair that we have at our Georgia Avenue site. So for those of you who may not have seen that article, Dr. Gesker, if you'd like to talk a little bit about that, that would be great.
Oh, I would love to. The special needs service that we're providing in dental is going to be probably one of our most rapidly growing services. There's simply just not enough dentists willing or comfortable to treat patients with special needs in the DMV area. We're onboarding in the process of hiring a doctor who specializes in dental special needs, which I'm really excited to get her on board. But the challenge that we have is facility capacity. If we see a special needs patient, we have to slow down operations and not see maybe 2 or 3 other patients. Not because the dentistry is necessarily that much more complex, but it's basically they need more logistical time and just need a little more time to manage the patient through the care. One thing that people don't understand about special needs dentistry, let me tell you a secret, it's the same exact dentistry, right? But the cadence and the methods and the approach is just had to be slowed down a little bit to give the time and care and love to that patient that they desperately need. One of the saddest things about special needs is that often they suffer in silence. They're not able to communicate with providers or their caretaker. And you start doing the dental exam and it's far more advanced than what we anticipated. So, like every other service line, it's we have to see a certain number of patients every day just to break even. And a special needs patient slows down our rate of care, but that's what we're here for, right? We're here to take care of all members of the community. The term special needs is broad, right? It's kind of like the catch-all for the type of patients that most providers don't want to slow down their practice for. So we're excited to expand that, and you'll see more to come in hopefully this fall when we're able to add additional chairs. And through your support, it's a direct line to direct patient care, and we're really proud about that. So thank you for taking time today to even be on this call.
Great. And I know, our doors are always open. So if anyone on this call today would like to come and see for your very own eyes any of the services and facilities that we've been describing today, please reach out to me or anyone that you are in contact with at Mary Center, and we can set that up. We also have regularly scheduled tours taking place just about once a month. So we will share that information out next week when the next one is scheduled, when we send out the recording to this meeting. We have one last question that's come in here, and it is regarding our sliding fee scale. The question is, I've heard Mary Center mention the sliding fee scale in the past. What is it exactly, and who is eligible?
Well, I'll take that, Heather, and thank you for asking that. I mean, these are all great questions because really it comes down to just following through on our mission. And certainly it's one thing to have providers, it's another thing to have staff and everybody else around. It's another thing to be able to make sure that we are doing what we can to support the community regardless of their ability to pay. And that's where the sliding fee scale comes in. As a federally qualified health center, that is absolutely imperative that regardless of their ability to pay, it's something we embrace wholeheartedly. The sliding fee scale is designed for all of you to support individuals who are making less than 200% of the federal poverty guidelines, depending on their family size. And once we go through that process of assessing their status or their financial situation, they then fit into a category. And where they go, we have different levels of the sliding fee scale, as low as $20. And in some situations, individuals, they might not be able to afford that. And so we definitely have to sit down with them and work with them on that. And so we don't want them to not receive care because they can't afford care in the moment. And so that's where the sliding fee scale kicks in. We review it every year. It is something that we get together collectively as a team. I'm very happy to say that we have not increased that sliding fee scale for quite some time, simply because we understand that it's challenging for everybody to get in. But the one misunderstanding is that the assumption is that it's only for people who don't have insurance. No, you could have insurance, but you might not be able, you still might fit within the category of less than 200% of federal poverty guidelines based on your family size. And so we're not ever going to charge you more than what fits into that sliding fee scale. And it really does enable people to come in and receive care. So hopefully that helps everybody understand what that means.
Thanks. Thank you so much. And we do actually have another question that's just come in. This is regarding long COVID. The question is, I used to hear a lot about long COVID. I'm not hearing anything more about it. Is it still a thing out there? And if so, is Mary Center addressing it?
Yes, still a thing. Yes, we're addressing it. Those are two quick answers. Dr. Sarah Ali is our infectious disease specialist who works in the long COVID clinic. And so we recognize there are a number of different factors and presentations and how it can come. What was noticed early on is that individuals, in particular women who suffer from COVID, had neurobehavioral issues. And so it's something that we, as a medical team, we've identified and made a commitment to make sure that we're there. And we'll even take referrals if people are concerned about it. And a lot of times the referrals are from within, but one of the providers somewhere else may have noticed something and said, hey, look, I think we're seeing something here. So let's have you meet with Dr. Ali and the team.
Thanks. And one more. This is similar to the sliding fee scale question, but what percentage of participants are you seeing now that are uninsured?
Yeah, we, excuse me, and that cough is not long COVID, not to make light of anything. We typically run around 18%, 18 to 20% of individuals that are uninsured. That typically tends to be a little higher than other FQs, but that's where Mary Center has resided. I would say that's across all 5 sites. Again, each site is unique in their own space, and the site in Prince George's County, during some months it was as 55% uninsured, but because we look at it as one single entity, we recognize that that's just the work that we endeavor to do to support the communities. And we actually look forward to supporting Prince George's County even more because we recognize that there's just so much need.
Thanks so much. Right. Well, we're coming close to the end here of our town hall. Thank you so much. If you have a question that we did not get to answer, we're happy to follow up with you. But it looks like we actually had the time to get through the questions. But at any point, if you have a question about Mary Center or want to hear more about any of the programs, please reach out. There's one last bit of information we'd like to share here, since we often get asked, how can I help Mary Center? And this is really something that everybody can help with. Please help us promote the good work taking place at Mary Center in all the ways that we're hearing or sharing here on this slide. If you're in contact with companies or local businesses, please make introductions for us. This is an area of our revenue that we're growing, is our corporate funding line, and we're always looking for introductions. We're very much, as you all may know, we're in the community, we're in 3 sites in DC and 2 sites in Maryland, 1 in Montgomery County, 1 in Prince George's County. And we really look towards partnering with all the local businesses that are, near our sites and in those communities. We also run regularly in-kind donation drives. Right now, we're running one for diapers. As everyone knows, diapers are expensive. And for many of our participants, they're having to make choices between purchasing diapers and other necessities. We receive thousands of diapers from our great partner, the DC Diaper Bank, but we also rely on you all, our supporters, to help promote our in-kind drives. So please go to our website, Ways to Help, and we have a tab there on donation drives. And we populate it with whatever needs we currently have that we're serving the community with. And lastly, please help us earn our 2024 Great Nonprofits recognition. This is really important to us. We know that you all supporters rely on services such as that to share what nonprofits are doing great work. We're looking for testimonials. It just takes a short post, just a couple sentences about what you appreciate about Mary Center. And if you go to www.greatnonprofits.org, search for Mary Center, and you can put your post there, and we will greatly appreciate that. So speaking of appreciation, thank you so much. We really appreciate your time today and your interest. We're grateful to all of you for your incredible support and your time today, and we hope you will enjoy the rest of your day. Thanks so much.
Thank you.